helping make your life easier. Moms Every Day.
Welcome to Moms Every Day. I'm your host, Jen Lennon. Today I'm joined by Raquel Wolf. She is a nurse practitioner with Revive of Colorado. Raquel, welcome.
Thank you for having me.
So, Raquel, tell me a little bit about Revive. What is it?
We do regenerative medicine
Okay.
and regenerative cosmetics
Okay.
and hormone replacement therapy.
So what exactly is regenerative medicine? What does that mean?
We help your body use its own healing powers.
Oh, okay. Well, that makes sense, right? Our body knows what to do.
Right.
So what you do is just sort of trigger a response. That's the idea?
Yep, we have stem cell therapy and PRP therapy.
Fantastic. So let's talk a little bit about hormones today, because we've all got them. We all need them,
Yes.
Men and women. So tell me, what goes on naturally with hormones in our body as we begin to age?
So starting at age 30, men actually can lose up to 10% of their testosterone, and women start losing testosterone at 25.
Really?
Mm-hmm.
Okay, now as a female, why? I mean, I think, well, so what? I don't need testosterone. It's estrogen I should be concerned about, but that's actually not the case, right?
No, testosterone actually protects our brain, our bone, and our heart from chronic diseases.
Okay, and are there, if you're starting to lose that testosterone, if you're dipping too soon, what might you be experiencing in your life?
Fatigue, mood swings, depression, decreased sexual drive, lots of symptoms that normal people contribute to aging.
Well, yeah, and I think, you said for women, dipping at 25 already, so you could be 30 or so, you're experiencing these things, and maybe you just think it's in your head, or maybe you just think it's the craziness of family life. It's worth getting a look at, right?
Right, yep. We draw labs right in the clinic, and free consult, and we look over to see where you're deficient.
So if you do find that you're deficient in these hormones, tell me a little bit about how hormone replacement has changed. You have something called bioidentical hormones now. What does that mean?
Right, so typically in a primary care setting, you would get synthetic. So the bioidentical is more about being a part of the molecular structure that our hormones actually create in our body.
Hence the identical piece, right?
Right.
It's what we've got inside of us.
Yes.
And so we've heard some negatives about hormones like that. You're talking, that's synthetics, then we have to worry about cancers and other things, right?
Right, cancers, there's a lot of side effects. So with the bioidentical, there isn't the cancer risk, and
Okay.
there's very little side effects.
So how do you go ahead and administer it? How do you get the hormone? Is it a shot? Is it?
Yeah, so it is a small incision right in the hip.
Okay.
And it's just little tiny pellets about this big. And I just insert that. And then women typically get it about 4 to 5 months, depending on their symptoms.
Okay.
And men get it about 5 to 6 months.
So that pellet is actually a really innovative delivery system. It's different than what people might have heard of in the past, right?
Right, so shots and creams kind of will do a roller coaster effect, especially the creams. You can get it on the dog.
Get it on other people.
Yeah.
You don't want to be passing around the testosterone.
Your husband,
Yeah.
And the shots, again, will just create more of a roller coaster effect.
So
with-
these pellets are consistent?
Yep, it's per your cardiac output,
Oh, okay.
and you get to more of an optimal range.
Makes sense. Okay. And then you know that they need to be replaced how? By just how you're feeling, or?
Yes, your symptoms, but typically, again, we're seeing that 4 to 5 month mark.
So if people are listening right now and they think this might apply to them, but they have questions, I know that you always want to talk to people, right?
Right. Yes. So our website, reviveofcolorado.com, has a lot of information.
Okay.
And then they can call the number on the screen and make an appointment, and we'll do a free consult and get some labs drawn.
So nothing to lose. Go in for the free consultation and then see if it might help you.
Yeah.
Fantastic. Thanks so much, Raquel.
Thank
I
you.
appreciate it. Thanks for joining me today and every day. I'm your host, Jen Lennon, for Moms Every Day.